This skin cleanser is used to help treat acne and other skin conditions such as seborrheic dermatitis and rosacea. It contains an antibacterial agent and a drying agent which promotes shedding of the top layer of skin. It is best to use this product as directed by your doctor. Apply a thin layer to the affected areas of the skin, usually once or twice daily. Wash your hands after using unless the area being treated includes the hands. Be sure to read the label for specific instructions and consult your doctor for any concerns. This medication is designed for use on the skin only. Before using this product, make sure to clean off any makeup, oil, and excess dirt from your face with a gentle cleanser. If you are using the liquid form, be sure to shake the bottle well before each use. If you are using the liquid cleanser, apply a generous layer of medication as directed by your doctor, usually once or twice daily. Gently massage it into the affected skin for 10 to 20 seconds until a full lather forms, rinse thoroughly and pat dry. If you are using the cleansing cloth product, wash the affected areas with a cleansing cloth as directed by your doctor, usually once or twice daily. First wet your face with water. Then wet the cloth with a little water and work into a full lather. Cleanse your face with the cloth for 10 to 20 seconds. Do not get the lather into your eyes. Rinse thoroughly and pat dry. If excessive drying occurs, you may need to rinse the cleanser off sooner or use it less often. Avoid getting any of this medication in the eyes, on the lips, or inside the nose or mouth. And as always, consult your doctor or pharmacist for further details. And be sure to tell your doctor if your condition does not improve or worsens. If you experience redness, irritation, or scaling of the skin, it's important to talk to your doctor. It's also important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. While most people don't experience serious side effects, it's important to seek medical attention if you notice cracked skin, unusual weakness or fatigue, dark urine, yellowing of the eyes or skin, signs of infection, easy bruising or bleeding, or swollen joints. If you're using this medication on raw or broken skin, you may be at an increased risk for side effects, so be sure to consult your doctor for more information. Although rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, such as rash, swelling, dizziness, or trouble breathing. And as always, if you notice any other effects not listed here, be sure to contact your doctor or pharmacist for further guidance. Before using Sulfacetamide-Sulfur-Skin Cleanser No. 23 9% to 4.5% topical kit, make sure to inform your doctor or pharmacist if you are allergic to sulfa or sulfur, or if you have any other allergies. This product may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have kidney disease. If you are planning to have surgery, let your doctor or dentist know about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, this medication should be used only when clearly needed, so it's important to discuss the risks and benefits with your doctor. Additionally, based on information about related drugs, this medication may pass into breast milk, so be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions as they can affect how your medications work and increase your risk for serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are skin products containing silver, such as silver sulfadiazine. If you suspect an overdose and notice severe symptoms like fainting or difficulty breathing, it's crucial to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. For Canadian residents, reach out to a provincial poison control center. Keep in mind that swallowing this medication can be harmful. This medication is used to treat acne. It helps to reduce the number of pimples and also promotes quick healing of pimples that do develop. Sulfacetamide and sulfur are known as antibiotic and drying agents. They work by stopping the growth of bacteria and reducing the swelling and redness of pimples. This product also contains alcohol, which helps to dry extra oils on the skin. If you forget to use this medication, use it as soon as you remember. If it's almost time for your next dose, skip the missed dose and continue with your regular schedule. Do not take a double dose to make up for the missed one. Make sure to store this medication at room temperature and keep it out of reach of children and pets. Do not dispose of this medication by flushing it down the toilet or pouring it into a drain unless instructed to do so. When this product is expired or no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for more information on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.